In this interview, I meet up with Dr. Anna Khaylis, who's a registered psychologist who has been helping individuals, couples, and families with a wide range of challenges, including depression, anxiety, eating disorders, relationship difficulties, and substance abuse. She is skilled at working with clients of all ages and brings warmth and authenticity to all the work she does. Let's welcome Dr. Anna Khaylis. Thank you so much for coming in today and doing this interview with me.
You're welcome. It's my pleasure.
Thank you. I wanted to start by asking you, during the lockdown, many parents had the opportunity to work with their kids at home, side by side. And what are some concerns you are hearing from parents now?
Yeah, across the board, we're hearing very consistent concerns. My child won't do online school. My child can't pay attention. My child can't sit for a Zoom meeting. Right? So we're kind of hearing loud and clear that this whole situation has been very challenging for families and parents and children, kind of across the board, in different ways.
So what kind of needs are you currently dealing with in your practice?
We've had a lot of kind of, I would almost call it burnout, right? From parents and kids. Just lots of frustrated and worried families, frustrated parents and children, kind of lots of anxiety. And we've certainly had, a lot of parents contacting us after spending a few months at home, trying to do schoolwork with their children and seeing that there's something here, right? Their child is really struggling in some areas. And kind of recognizing that after spending a few months at home with their kids. But of course, with all the frustration and the worry, it goes both ways, right? When a parent is frustrated and anxious, they cannot teach a child, and when a child is then feeling frustrated and anxious, they cannot learn. But for a child who's already struggling with learning and already struggling with school, to then try and sit down and do this at home and do this online, that can be extremely frustrating. And so we end up kind of in this, in this cycle that's really hard for everyone involved. And so I think we're kind of hearing loud and clear that that's, a lot of what's been going on lately.
Yeah, it was a major shift, right?
For sure.
Yeah, no preparation for it. So
it was a big change across the board, right? We talk about for us how all of a sudden our lives changed so drastically, all the work had to go online and we don't have our usual, we don't have our gyms and we can't see friends and all this stuff, right? It's been exactly the same for our children, right? Everything that they were used to, everything that they were used to using to help cope with what was with stuff that's going on like day to day, seeing their friends, playing sports, everything was kind of ripped away, and like you said, very suddenly.
So how would parents distinguish between behavioral issues and learning delays in their child?
Yeah, this is a very good question, and this is also a very tricky question, because we know that learning delays, it can often present as behavioral issues, right? So with a learning delay, you'll often see things like school refusal, just refusing to do it, meltdowns, right? Saying things like, I hate school, or I'm just bad at math. I can't do math. I can't write. I hate writing, right? And so a lot of times we take that as behavioral issues, right? But there really is an underlying kind of challenge that's going on, that is presenting as a behavioral issue. So I think a few warning signs to look for, right, to help a parent distinguish between the two would be like, does the child have a difficult time understanding the work, right? Understanding conceptually the work. So sometimes, for example, a child can read a paragraph, over and over again, or a page over and over again, but they don't grasp the meaning of that, right? When you ask them what they've read, When you ask the child to summarize, they cannot do it. So that's a pretty good indication, right? Or like in math, how that can come up in math is if you sit down with a child and you ask them how to solve a particular word problem or a particular equation, or you ask them, and they cannot walk you through it. They cannot understand how to arrive at the solution, right? So there's this piece about kind of conceptually understanding what's going on. I think another common sign is of a learning delay is retention, right? So you'll sit down with your child and you'll walk through some sort of some concept, right? You'll walk them through it and you'll review it and you'll teach them and you'll talk about it. And then the next day it's like starting from scratch. They have no idea what you've just done, right? They have no idea what was talked about yesterday. So that retention can also be a bit of a warning sign, right? If every day it just feels like you're starting from scratch.
Yeah. So what is the definition of learning disability, and what is the difference between learning disability and learning gap? Because these words are always used, right?
Yes, absolutely. The very basic definition of a learning disability is difficulty learning and using academic skills, right? And the key piece of this is that the particular academic skills significantly below what we would expect given the student's age. So it's this word significantly that helps us differentiate a learning gap with an actual learning disability. And so what we really need to pay attention to, and this is kind of a very quick answer to this, it's the size of the gap, right? Between a child's academic skills and what we would expect given their age. So if I can show you a graph, can you see this graph? Is that pretty clear?
Yeah.
So this is an upside down U. This is basically a graph of averages, right? So if you take kind of any particular, let's say reading, right? Any particular reading task, and you give that task to a whole bunch of kids, most kids are going to end up under this upside down part of the U, right? Where this shaded area is. So this shaded area is kind of where we would expect a child to fall, right? Where we would expect a child to perform given their age. The farther out they are from this under the U, right? The farther out they are, the farther they are away from where we would expect them to be. Either on one end, where they're performing at a level above what we would expect, or on the other end, where they are performing below most other kids, right? They're performing at a level lower than most other children their age. Now, how far away lower is what differentiates a learning gap from a learning disability. If it's significantly, and we have different kind of statistical ways of being able to understand this. If it's kind of statistically, if it's significantly below what we would expect, then we can say that it's probably more than just a learning gap.
Very good. Thank you. Thank you for clearing that up.
You're welcome.
Introduced, right? Like the people just use them back and forth, and then you get confused, right? Yeah.
Absolutely. Absolutely. Yeah. And, there are terms that do get thrown around quite a bit. And so I think that's we just need to be careful with that, because they're actually with something like a learning disability, there's a lot that goes into figuring out if it's a learning disability or not, right? And so we really want to make sure that we're sticking with the science and with the, with the diagnostic criteria.
Yeah, and if they're way on the lower end, that's learning disability. If they're close enough, then it's learning gap, right? In the shaded, like for generality, right? But if they're further on the higher side, then that's gifted. Is that correct?
Yes. I mean, again, it depends how far off on the higher side they are, right? Because you can have an exceptionally bright student, but they're not in that really tail end on the other side where we would see gifted.
Okay.
So I mean, same thing, same thing with the learning disability. So just because they're really off to one end, like that doesn't mean they have the learning disability. This is just another indication that we use, right? This is another
Yes.
piece that we use. There's a lot that goes into figuring it out. It's not just as, right? I provided like a very
Oh,
simplistic
yes. Yes.
kind of graph, right? But there's certainly a lot that goes into it to
Yeah.
make the diagnosis. But yeah,
Process.
you're absolutely right. Like if they're like far out enough over here, that would be the giftedness.
Yeah.
But they have to be
And
far off enough.
oh, yeah.
Yeah.
Just to clear that up, I'm not saying it's 100%
Yeah.
because you do way more investigation before
Yeah.
you actually say that to a parent, right?
Absolutely. Yes,
So important. You
absolutely.
don't want to give any wrong impression. But
Exactly.
only thing is that the parents just need to know the difference between those terms, right? Like it's
Exactly.
and also
Yeah.
when you do your work with parents and students, it's also about the child could have been sick for a couple of years, and that's why they're, you know what I mean, there's so much
Oh,
things goes
yes.
into it, right? Variations that
Absolutely.
to be
So
careful.
many different things. Another thing that we look at Sandstory is also the child's cognitive abilities, right? So a child's ability to learn. And that's another piece, right? So we look at kind of on this graph, we look at the difference between the child's ability to learn and the child's academic skills. And so
Yes.
again, if that difference, right? We look at that difference, we look at where they are compared to other kids their age. So we look at all of these different things
Yeah.
to piece that together for a diagnosis.
It's a full investigation, isn't it?
Yes, it sure is.
Right. So, is there a quick assessment a parent can do, or is it a job of a professional like you when it comes to?
Yes, that's a really good question from what we've been just talking about, right? Um, yeah, a learning disability really should only be diagnosed after a comprehensive psychoeducational assessment. So a psychoeducational assessment includes testing, like I said, testing the child's or the student's cognitive abilities, so their ability to learn, testing their academic functioning, where their academic skills are, and then also getting a sense of their social emotional functioning.
Mhm.
Um, and so it's only after kind of putting all those pieces of the puzzle together, using these kind of graphs that I showed you and to help understand the results and really kind of piecing all of this together, only then can we really make a valid conclusion if a learning disability is present or if it's something else that's driving the difficulty.
Yeah. The only thing as a parent we can do is just monitor, like how often you said some of the things to look for, right? How much are
Yeah,
they retaining? How much are they, getting involved in
yeah,
solving and all that? Just noticing
yeah,
it as many times. How many times is it happening? If it's happening
yeah,
over and over and over again, then
yeah.
that's a concern, right?
Yeah, exactly, exactly. And, a lot of times I think parents also, we have a lot of our own stuff that goes into this, right? Maybe our
Yeah.
own expectations,
Oh,
our
yes.
own attitudes about school, our own thoughts about, where the child should be, or,
Mhm.
all of this stuff kind of goes into it too. So,
Sometimes
um,
the milestones kind of blind parents, right? Because we get so
yeah,
concerned if my child doesn't reach this milestone when they're especially young, right? They're not
yeah,
reading by a certain age, but
yeah,
sometimes some
exactly.
child is a little delayed, but then they pick up
Yeah,
reading, no problem, right?
yeah, yeah, absolutely,
Yeah,
absolutely.
yeah, very, very important to, if there is something, that's when you're there to give a clear picture, right? Map it out and tell us what it is.
Exactly.
Yeah.
Yeah, exactly.
Why do parents have a hard time accepting that their kids might have learning delays or learning
Yeah.
disability? And what do you advise if parents are noticing there's a delay in their ability to learn? In their
Yeah. I mean, it's really understandable that parents would have a hard time seeing their child struggle, right? And that this would be really hard to watch and really hard to accept. And, like I said earlier, especially if we as parents, if we're coming into it with our own set of attitudes and expectations about school and about, for the child, we're kind of putting that on it. So um, I think that's certainly one of the reasons why a parent might kind of have a hard time, right, accepting that there's a learning delay and that there's something going on. But if parents and teachers, right, parents and or teachers are kind of noticing consistent struggles or consistent learning delays, it's really important to consider obtaining a psychoeducational assessment for that student.
Mm-hmm.
Yeah.
And a
And
lot of the time, teachers advise parents to go do these kind of tests because
yeah,
why do they advise, like a parent can't tell but a teacher can? Can you explain why they're
yeah.
able to tell?
I think teachers probably have a better understanding maybe of what that shaded area for a child looks like, right? Because they're with a whole classroom of children kind of day in and day out. And so they probably have a bit of that sense um, of where that child really is compared to the majority of kids, right? And kind of can grab like if there's a consistent kind of learning delay going on.
Mm-hmm.
Um, I think the flip side of that, though, there's a flip side to that, which is that teachers also are, they have large classrooms, they have a lot going on. And so a lot of parents, after spending these months in lockdown, a lot of parents have been the ones to notice, uh-oh, like there's something here. I
Mm-hmm.
don't know what it is, but there's something here.
Mm-hmm. So
Um, and so I think with both parents and teachers, everyone's kind of doing the best they can, um, and they're noticing these things. But again, with parents, I think teachers have that advantage that they have a classroom of children, so they
mm-hmm.
can kind of pick up on that delay. But I think parents have the advantage that they know their child, right? And they know their child's strengths and they know their child's areas of growth.
Yeah,
So I think
in a
it's kind of
way,
works together.
yeah, and in a way, this COVID is a bit of a, even though it was a shock for a lot of parents, it's actually
Yeah,
highlighting or, bringing something up that they may not noticed before about their
yeah,
child, right?
exactly,
Mm, mm,
exactly. But I will say that unfortunately there's no easy answer, right? So if your child is struggling, if a child is consistently struggling, probably the best way to go about it is to contact a specialized practitioner, someone
point.
who can give you
Right.
some more information on a psych ed and what that would look like.
Yeah, yeah. Many parents delay coming to you guys as a practitioner, right? To
Yeah,
you because they
yeah,
worry that their kids are going to be labeled, because one of the things that comes after these kind of analysis is
yeah.
a label, right?
That's
So
right.
why is
That's right.
it important that testing is done if
Yeah.
you think your child is struggling substantially? Like, it's not like one day they don't want to do homework, you don't want to
Yeah.
come to you, right? But
Yeah.
consistently there you're seeing
Yeah.
something is wrong here, right? And
Yeah.
parents can
Yeah.
tell, because when
Yeah.
they're the best judge.
Exactly. I think what you're referring to, what you're touching on, is the stigma that's still around and that's still associated with these kinds of diagnoses that we give, right? And not just the learning disability, but really a lot of the mental health diagnoses, depression, anxiety, and right. And people do view it as these labels, right? It's like, writing like my name is depressed, right? And putting it on your forehead. And that this is really something that's just going to stick with us and stay with us
Mm,
for a long time. And so that's, it's really understandable that there's this worry around, oh my gosh, is my kid going to get labeled, right? What's that going to look like for the future? Um, I think the kind of maybe another way to think about this is that the diagnosis, if we use the word diagnosis maybe instead of label, that can ease some of that for a parent, because the diagnosis really allows us to then treat the child's specific needs.
yeah.
Um, it's like, think about, you have an earache and you don't know what it is, but your ear hurts and it's bothering you and it's been bothering you for a few days.
Mhm.
You go to the doctor, right? The doctor has to figure out if it's an ear infection or if it's something else going on. Because if it's an ear infection, you get antibiotics as treatment. If it's something else, you get other treatment, right?
Mhm.
Um, and so it's really, really important to have a correct label for what's going on, so that we know how to treat it, so that we know what to do for it.
Yeah.
Um, I understandably, of course, understandably, right? This is a lot different than something like an earache or an ear infection,
Yes.
because it's, it, it just has a different kind of connotation to it. But in my experience, receiving a learning disability diagnosis has provided a lot of relief to parents and students alike, because finally they realize eh, they're not stupid and they're not lazy, and
Mhm.
my ear doesn't hurt just because it's a bad ear, right? There's something there that's going on.
Yeah.
And now we can put a name to it. And so that means now we know what we can do with it.
Mhm.
Um,
Especially
so
in a school environment, these
yeah,
labels, as much as, sometimes they do hurt you in a way because
yeah,
it can, but most importantly, it does get you the right help you need. Otherwise, you're
yeah.
just sitting there calling yourself, I'm dumb, I can't do
Right,
this, my friend can
right,
do it, why can't I do it, what's wrong with me?
right.
Right, all these questions,
Absolutely.
right?
Yes, absolutely. This reminds me, Kohila, you asked me earlier about warning signs for a learning delay. Can I
Yes,
go back to that question really quick?
yes, please.
Another sign to look out for is this is taking me so much longer than my friends,
Oh, okay.
right?
Mm.
I'm trying to do it and I'm working hard, but it's just taking me such a long time
Yeah.
compared to what I see my BFF over here next to me, da 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 da, and she's done, right?
Mm.
But it's
Yeah.
taking me such a long time. So that's definitely, I think, another kind of warning sign to look out
Sign to watch out for.
for. Yeah.
So why do you think it's good for parents to get them tested, to get a label, and
Yeah.
so that it's more it's not anymore a puzzle, right? It's more
Yeah.
you
Yeah,
have an idea what it
exactly.
is.
Exactly. The diagnosis allows the child to receive targeted accommodations and treatment for the child's specific needs. So
Yeah.
the diagnosis then allows the parents to show the school, like, look, this is what it is, this is the diagnosis, and then the school can work with the parents to develop a specific kind of, specific plan to address this.
Yeah. And in
Um,
September, if they go on to this blended learning or homeschooling or however,
mhm.
parents choose to
Yeah,
homeschool their kids,
yeah,
it would be a great thing if they did notice over the COVID or the
yes,
lockdown to, figure out what's actually going on so they'll get a
yeah,
better help, right? Even if it's
yeah.
online learning,
Yes,
probably.
exactly.
Mhm.
Exactly. I think a lot of us have probably seen this cartoon. It's usually used to illustrate equality versus equity, right? Where
Mm.
you have three children trying to look over a fence, and you
Mhm.
have a really small child and you have a medium-sized child, right? The really small child can't see at all, like nowhere near. The
Mm.
medium-sized child is like can't see over the fence, but can, is in the middle, and then a tall child just kind of peeking over, right, can just see over the fence. And
Mm.
what happens if you give all three children the same box, the same size box to stand on,
Mm.
right? The little child still can't see.
See it.
The medium child can barely, barely peek over, and then the tall child can see really well,
Mm.
right? So what this diagnosis allows us to do is to figure out
That's size.
which box this particular child needs and
Perfect.
how we can give it to them to help them see over the fence with everyone else.
Perfect. Good. Good analogy. Thank you.
Thank you.
So you've touched on what is the purpose of label. So the main
Mhm.
purpose of label is to take pressure off, like, or
Mhm.
this unknown pressure for even not just for parents, but students feel it heavily too, right?
Mhm.
As we
Yeah,
talk.
absolutely.
Yeah.
Absolutely. And I would use the word diagnosis, right? Even instead of label, I would say the
Label.
diagnosis. Yeah.
Mm.
It can, like, we said earlier, like it can just provide a lot of relief because all of a sudden the child's not stupid and not lazy and not
Mm.
trying hard enough, but there's actually something there, and now we know what it is, and now we can tailor their box, their
Yes.
proper box.
Yeah. Make the right box for them, the right height.
Yeah.
And then
Yeah.
the younger they are, parents have a hard time admitting that
Yeah.
they have something that we're noticing something different, right? But
Yeah.
the older they get, you said that when your conversation one time, you said that the they actually feel relief now. So,
Yeah, I've tested quite a bit of adolescents in high school and also college students, right, who are getting this for the first time in their lives, right? They have struggled, 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 struggled,
mm,
and maybe have even gotten through, like have been able to graduate with, right? but have struggled in terms of like taking lots of time. It takes so long. And, um, across the board, I would say the general sense is one of, wow, now I finally know what it is. It wasn't just me not trying hard enough. It wasn't just me kind of, doing something wrong. It was like, this makes so much sense. Um, yeah, so that's always been really neat to see with the older
Sense of
students.
relief for
Definitely a sense
all
of
my
relief.
troubles. Now I have an
Yeah.
answer. Oh wow, right? But yeah,
Yeah.
it's hard to walk. It's like walking blind, right? Sometimes.
Yeah, absolutely. And you're just, trying and trying and trying, and it's just so hard. That can
Mm,
be really, really frustrating.
yeah.
Really frustrating. I
So
think another thing we talk to parents about, right, that and maybe another thing parents worry about is that what this diagnosis will do is will provide their children with an excuse not to do school, right?
yeah.
Oh, I'm just not going to do any math. I have a learning disability in math, so there's no point in doing math. So we really try to talk to parents and children about, the diagnosis is a reason for why you're struggling, but it's not an excuse not to do the work. We
Yes.
just need, with the diagnosis, we can now figure out how to approach academics differently with you. Not
Mm-hmm.
just make you do more and work harder, but actually figure out how to do it differently so
Yeah.
that you are able to do it.
Yeah, yeah, that is such a good point because as working
Yeah.
with a lot of students, one of the things they say is,
Yeah.
can you try this or something? Then the first thing they pull out, it's like a card. I have learning disability. Sorry,
Yep.
right? It's
Yeah.
like it becomes a habit, right, for them as
Yeah.
an excuse. So it's not an excuse.
It's not an excuse, right? It's a reason, it's not an excuse.
Awesome. Thank you for that.
Yeah.
If parents choose to educate their kids at home coming September,
Yeah.
right?
Yeah.
What's your advice for them? What's your advice like?
Have lots of patience. I mean, in all honesty, right? I think above any academic recommendations, above and beyond all the academic stuff, what we really try to help and advise parents to do is to nurture their child's emotional self, right? To nurture their
Mhm.
child's emotional being. Um, when a child is coping with internal upset, be it stress about school or frustration that they're not getting something, or worry, right? That child is not as able to be present and is not as available, right, to learn if they're busy trying to deal with the emotional stuff and to cope with the upset.
Mhm.
Um, and so I think maybe another way to think about this is the behavior that we see from a child. It's the tip of the iceberg, right? It's
Mhm.
only the tip. It's the only part that we can see. And what we cannot see is this entire like land mass, right? Underneath this little
Yes.
tip.
Yeah.
Um, and underneath that iceberg, it's a whole mass of emotions and needs
Yeah.
that is really hard that we don't see. Um, and so, a child is not trying to be willfully bad or willfully lazy or a bad listener, right? Under this behavior is always driven by some kind of need or some kind of emotion,
Yeah.
whether it's frustration or boredom or fear or a need for connection, right? There's always something that's driving the more challenging behavior that we're seeing.
Mhm.
And so when we as parents can recognize that,
Mhm.
then we can start addressing the behavior in a way that will protect our relationship with our child and that will
Mhm.
protect our connection with our
Yeah.
child.
Yeah.
And I think that's kind of above and beyond any academic
Yeah.
recommendations that we give. I think in terms of academics, right, we can apply the same thing to
Mhm.
academics. So, when a child is struggling either with a learning delay or with a learning disability, I think our instinct is just to have the child do more work, do more, practice more, right? More practice. That often backfires because
Yeah.
what it does is it just elevates more stress and more anxiety, and then it's harder to learn, right? And so we kind of get stuck in that. For example, like a child who struggles with reading, we just instinctually, we just, read more and read more and do
Mhm.
more.
Mhm.
But then imagine, right, if that's already challenging, We're just telling the child, just read more and do more, read another
Punishment.
page. It's going to be really, really anxiety provoking, really stressful. And so, for example, in this example, something that we suggest is, rather than making the child read more, read with them,
Mm.
read to them, right? Snuggle up and read together and read to them. And pause at different moments and talk about what you've read and ask the child questions about what you've read and discuss it and I ask them about it. And I think this will help the child then associate reading or any academic skill that you apply in this way. It'll help them associate that with warmth and closeness and connection, which will then help kind of ease that emotional piece.
Yeah.
So
100%,
yeah,
because even for math, right, those
yeah,
worksheets sometimes are not the best way for the kids to learn when they're not ready or motivated to do it. But
yeah,
if you bring it into everyday life, because math is everywhere, right? So that's
yeah,
one of the things that I
yeah,
advise all parents is to try teaching math anywhere, in your kitchen, outside, in your grocery
yeah,
store, wherever you are. Just make
absolutely.
it fun activity, and then
Yeah,
it'll remind them of those fun times rather than math,
yeah,
because the math is kind of
absolutely.
those scary words. It's still not
Yeah,
with workbook, right? It says it motivate sometimes your student, I mean your child. So
exactly.
you have to watch out for it.
Exactly.
So do you you work with learning disability kids a lot, right? You help them a lot, right?
Yeah,
Kids with learning
yeah, we
disability.
do. We do assessments. We do the psychoeducational assessments. We also provide counseling to children, and we provide parent consultation. So that's where we work with the parents, and everything is done from an attachment-based perspective
Mm-hmm.
in terms of the therapy and the counseling. So that means that we help, parents kind of navigate these more difficult behaviors, but in a way that would protect and nurture their relationship.
Yeah, it's
Yeah,
not with medication, it's through therapy,
yeah,
right? You
yes,
provide
yes,
that. And I
yeah,
think you said very well earlier is that the tip of the iceberg, right? Which is
yeah,
underneath the surface, there's a whole bunch of stuff happening. But as a parent, you
yeah,
really have to analyze where that behavior is stemming from below.
yeah,
What's that unmet need
yeah,
for your child, right?
exactly,
And
exactly. And that can be really hard to do for a parent who themselves is feeling activated or frustrated or triggered, right? Then it can be really difficult to to kind of keep that mindset. So that's a lot also of, working with parents and helping them kind of navigate through their own stuff that's coming up, because we'd love to live in a world where all parents are just perfect, right, and can respond to every behavior in in a perfect way. But parents, we have our own upbringing and triggers and
so what do
emotions.
you recommend I should, like, if I have that kind of moment as a mom or dad, what should we do?
Yeah. Well, if it's consistent, if it's happening consistently, then we would probably suggest to come and speak to someone about it,
Okay.
and to and to explore that more deeply, and to explore these concepts more deeply.
Yeah.
But in general, like in a very, very basic nutshell, I think an image that we show parents that's really helpful is like if the child is escalating, we want to think about de-escalating and making ourselves kind of more calm
Both
and more
party can
sensitive.
go like that.
Yeah.
One party has
Yeah,
to
yeah,
offset. We have to offset that.
exactly, because without even realizing, a lot of times we get elevated and escalated, and that just sends the child right up, right?
Mhm.
So
And you're right. We're parenting our children in a different era, right? Like we weren't parented
yeah,
like that, right? Most of our
yeah,
parents would say, I mean, hardly talk to us, about
yeah,
feelings, right? Like we
yes,
didn't have that, right? I don't know about you, but I never had that. A lot of feelings weren't
yeah,
discussed. It's the way you do stuff. Just go sit and
yes,
study or do the way it is. That's the way it is, right? So
exactly, it's just the way it is.
yeah,
Yeah.
so we're
And so we
actually,
bring that into our parenting, right?
yeah.
And I believe this idea of like the child escalating or the child de-escalating, I believe that comes from Gordon Neufeld. I
Mm,
believe so. If a parent is interested, that's definitely
yeah,
a
yeah,
resource to look into. But absolutely, what you just said, that we are all parented a certain way,
yes.
and that can absolutely show up, right, in times of frustration, times of anxiety, and times of worry. And so it just takes a lot of kind of reflection, a lot of work to
Yeah. Yeah.
manage
I'm no
that.
perfect either, but only thing I know is
Yeah,
I always know that I don't want to parent my child like I was parented.
yeah,
Right, that
yeah,
feeling. And also I want to be the
yeah,
teacher I always wanted to have, right? These are the two
yeah,
things I always tell when I'm working. I say
yeah,
I want to be that teacher I always wished I had. So if you
yeah.
keep, you also want to be the parent that you wish you had maybe sometimes.
Yes,
So
exactly. It means you've done a lot of reflection, which is wonderful.
so we can only try, right? But we're not perfect, but we can try our
Exactly,
best.
exactly. We're doing our best, and no, nobody can be perfect.
Yeah,
Nobody, no one, nobody can get it right 100% of the time.
time.
We
Yeah.
just, we just need to do our best.
And then we have to have the same compassion for our kids. They can get it if they need time to learn. If there
Yeah,
is a gap or disability, we
yes,
just have to allow them to come to that point and learn. Give them that
absolutely.
space.
Yeah.
No better place
Com
than home, I think. Right?
Compassion is a great way to frame it, right? Compassion for our kids, compassion for ourselves. Um, I
Yeah.
think just across the board.
Yeah.
Yeah,
At a time like this, especially when things
yeah,
are uncertain, compassion
yeah,
is a very good word
yeah,
and something to feel. Thank you so much for
yeah,
coming in today and taking your time to
yeah.
explain some of the things, it's puzzling for parents right
Okay,
out there
great.
because,
Yes, my pleasure.
yes, thank you very, very much.
Yes, thank you very much for organizing this and for having me on.
Thank you.